Good morning, everyone, and thank you, Lauren, for inviting me to speak today. I feel like a bit of an imposter, actually, after yesterday and hearing all those wonderful stories, because I was here for a short time in the 1970s, first as a student at Grad Dip and later on as a staff member, but I was here for such a short time and then disappeared to Australia, and I guess Lauren's interest was in what happened next. So that's really what I'm going to talk about, my journey from exercise physiology to physical activity and public health. So the story starts in Birmingham, 1972, where I graduated with a degree majoring in human physiology, which was very unusual. I published my undergraduate dissertation, honours dissertation, in the Journal of Physiology, and we heard yesterday about presenting at the Physiological Society, which I did at that very early age, and it was very traumatic. But having done all of that, I really had no idea what I wanted to do. I had always wanted to be a PE teacher, but my parents thought I was too smart. So I was not allowed to take the position at IM Marsh, which was the girls' equivalent, I guess, as the #1 PE place for women at the time. And instead I went to Birmingham to do this degree. But at the end of this degree, I had been playing a lot of hockey in Birmingham, and I joined the Birmingham Phys Ed graduate girls, who mostly came here to Loughborough to do their certificate of education to enable them to teach. So there were 7 girls from Birmingham who came across to Loughborough, and I decided to try to apply for this certificate of education in physical education, despite having done no physical education ever. And I was accepted after a rather torrid medical, and like Martin, I was found to be an inferior specimen. I was told I had lumbar kyphosis and flat feet, but they didn't think it would be too much of a detriment to come and study physical education. So we spent a year here playing every sort of game, being graded in every single aspect of every sport you can imagine, and being taught by some of these stellar educators who are sitting in the audience. Robin, I will never forget the gymnastics and dance. Rex with all kinds of minor games, different sorts of games, but legends like Colin Hardy and Basil Stamatakis. I had the pleasure of being taught by all of these people. Alan Guy was the course coordinator at the time. And I have to mention Rod because I was on track to get a distinction in physical education, but I had one problem, and it was tennis. And thank you, Rod. He gave me a C-, and it managed to just keep me up there to get the distinction overall. So thank you, Rod. So having got the certificate of education in physical education, I took off to Edinburgh, where I was appointed to Dunfermline College of Physical Education, which is the girls' PE college in Scotland. The boys went to Jordan Hill at the time, the Scottish would-be PE teachers, and the girls all went to Dunfermline College. And I taught physiology there for a year. And they said that if I was serious about becoming an educator, I had to go into a school and get some experience. So I was appointed to Craigmount High School, which is the largest comprehensive school in Scotland. And that taught me that I did not want to be a physical education teacher. I really wanted to teach physiology. So I headed back to Loughborough in 1975 and completed my master's in human biology, doing subjects like work physiology, nutrition, ergonomics with Ernest Hamley and John Ather and others. And by this time, I think I already had African violet blood. I was really, really embedded in this Loughborough scene of learning about how the body works and trying to understand physiology and how it impacted on performance. During that year, I wrote a dissertation, of course, and I worked with Peter Jones, spent a lot of time putting people in this modified dustbin to measure their density, and we looked at body fat and physical activity. So at the end of that year, I guess it was serendipity that the person who had been teaching physiology here at Loughborough retired, and they needed someone to teach physiology. But what was really needed at Loughborough in 1976 was women on staff. So here I was, a woman with a physiology degree, master's in physiology, and I was fortunate to be appointed as a lecturer in physical education. and I tried to set up an exercise physiology lab, small lab over in the PE building, one bike, one Douglas bag, and a hemoglobin machine, I think was about it. And because there wasn't that much physiology to teach, I was also asked to help Colin Hardy with the swimming, because by now we had girls and they couldn't be left alone with a male lecturer. So I was the token swimming instructor, and I took over the hockey team. And at the time I was sharing an office with now Baroness Campbell, who taught me a lot, and she was of course looking after netball. But I took over the hockey team and we won the national championship, not because of my coaching, and Mary, you came later, but not because of my coaching, but because we had all these stellar women hockey players here, and they would have won anything anyway, I think. But my research interest was developing, and I was particularly interested in the sex differences in performance and in physiology. And this was stimulated mostly by the fact that women were starting to run marathons at the time. And this quote from de Coubertin in 1928, who said that women were not physiologically equipped for endurance exercise, because in 1928, they had 5 track and field events for women, the 100 and the 800 meters. And in the 800, most of the participants who were only trained to run 100 collapsed. And de Coubertin said, that's it, no more endurance events for women. And they didn't appear back in the Olympic program until 1960, when women first ran the 3,000 meters. But then everything changed. I got married and my husband said, would you like to go to Australia? I was like, oh, I don't know, things are just really taking off here in Loughborough. But to be honest, apart from the African violet blood, which I now had in my veins, there wasn't much happening in exercise physiology. Clyde was yet to appear, and I think we overlapped by about 4 or 6 weeks, I'm not sure. And I thought, come on, let's go. Nothing ventured, nothing gained. So this was the beginning of my career as a trailing spouse. Now, young women in the audience will not understand this, but in those days, the primary concern was always with the man's job, and the women followed. And that was really quite traditional at that time. So off we went to Newcastle, New South Wales. I had never heard of Newcastle in New South Wales, but there was a brand new medical school there. And it was modelled on the McMaster problem-solving idea. And I was introduced to the professor of cardiology. And he took me into this room, which looked much more advanced than anything I'd ever seen in Loughborough. We've got a bike and a big TISO spirometer and ways of measuring cardiac output and oxygen uptake, all this equipment. And he showed me into the room and said, do you know how to use this? And I said, well, yes. And he said, well, come and have a talk. And I told him about my interest in sex differences. And he said, why don't you do a PhD? And immediately conjured up a scholarship. And I thought, well, I'm here for 3 years, I might as well. But it was never on my plan. But I completed the PhD. We looked at cardiorespiratory and hormonal responses to graded exercise and to endurance exercise in men and women. And I think we were the first to show that estradiol levels during exercise were higher in men than in women, which was a shock to me and to everybody else. And I published results in various journals. We measured impedance cardiography for cardiac output, published in some prestigious journals. So I was still going along as a research academic, and then of course presenting at conferences at the time. Slides had to be drawn by hand in those days. So you took your results and drew them with letraset and stencils, and you had to put them into a light projector, which has disappeared from this. There was a light projector here. I don't know where it's gone. Inevitably, one slide would be upside down and back to front. You'd go through your presentation and think, oh, I put that one in back to front. So those of you that can read upside down and back to front can see here that the estrogen levels in women during endurance exercise, if this works here, were quite high. But these are trained women and these are untrained women. And the levels in the trained men were the same as in the untrained women. So I was starting to think about the role of estrogen and health and heart disease, and things started to get interesting. And then, of course, there was a promotion. So I'm going south to Sydney. Okay, I'll come too. The PhD wasn't finished. I had no access to computing support, and my supervisor didn't believe in black box. I think it was called BMDP, biomedical something for statistics. And he said, no, you have to do it by hand. So I did all my analyses by hand and typed them on a typewriter for my thesis. This is an analysis of covariance. Fortunately, the sample sizes were quite small, so it was possible. And at the same time, as more pictures disappeared here, I had a picture of my first son born in 1980, who disappeared. And then in 1984, I graduated with my PhD on the day that the women first ran the marathon in the Olympics. So that was serendipity, Los Angeles, and of course the women, most of them completed. And my second son was born that year. So I'm in Sydney as a trailing spouse, wondering what will I do? And Peter had a sabbatical in Leeds at Carnegie, and we were both offered jobs there. So the decision was, will we go back to the UK or stay in Australia? And we decided to stay in Australia. And I spent the next 5 years doing what I call juggling time. So mother of two, PhD, no jobs, no interest really much, a little bit maybe at Sydney Uni in exercise physiology, but nothing much for me to do. So I took on jobs as in teacher training, and I worked with Gary Egger on fitness leader accreditation, which was starting in Australia at the time. But I think the main turning point from exercise physiology to public health was when I worked at the Sydney Adventist Hospital. It's Australia's biggest private hospital. And I was employed to provide in and outpatient education and to run corporate health promotion programs for high-end executives from the banking and legal industry. And I worked as a clinical exercise physiologist, which had never been heard of. The term was not used. I had a badge, Wendy Brown, clinical exercise physiologist, and I did hundreds of stress tests and counseled executives about their weight management and lifestyle. I started to be a little concerned about this work around about 1986, I guess, because reading the work of Jeremy Morris, which was nicely described yesterday, that really we had to start thinking about increasing rates of heart disease and growing rates of heart disease. And these were prevalent in the less advantaged areas of Sydney in the western suburbs. And here was I working in the northern suburbs, which are very wealthy, very advantaged, running programs for what I call the healthy, wealthy and wise. So Adrian's description yesterday about Jeremy Morris and the bus drivers really inspired me to learn more about epidemiology. And then, of course, more trailing back to Newcastle. And there I was offered a job in the Hunter Area Health Service in a joint position financed by both the university and the Hunter Area Health Service. And within health promotion, I was given responsibility for women's health because I was seen to know about women's hormones. I didn't know anything really about women's health, but I took on this position, which was a joint research and service position. And of course, as a taxi driver and a sports coach and looking after two young boys going through primary school. And I got my first competitive grant from the National Heart Foundation of Australia, where is a randomized control trial looking at the effects of diet and exercise for women from non-English speaking backgrounds. So Newcastle has a very large proportion of Greek and Italian migrants who typically are very inactive. So I started this program, Fighting Fat and Fighting Fit, was given money to do it and it seemed to work, so that was a good start. When I saw this advertisement for applications to conduct a longitudinal study of women's health, I'm not sure at the time that I really knew what a longitudinal study was. But I talked to the professor of statistics at the university who had quite a bit of experience, Annette Dobson, in something called the Monica study, which was an international heart disease study. And five women decided to apply for this grant of $3.5 million, which is a bit of a long shot, to be honest. And to our surprise and to the chagrin of the 19 male professors in the university, we were given $3.5 million for the first 3.5 years to set up this Australian longitudinal study of women's health, which is now called Women's Health Australia. We decided we would randomly select women in 3 birth cohorts from our Medicare database. So it wasn't a volunteer study, it's a random sample. And the study would include all aspects of health. Well, that was the idea, but there were 5 of us. One was interested in time use, a sociologist, Lois Bryson. One was interested in life stages and key events, another violence against women, and one interested in health services. And my little area down in this corner was weight and exercise. So we started the study in 1995-96, and it's grown to include practically every aspect of women's health possible, and has of course continued longer than the first 3.5 years. So we have our 3 cohorts. They were 18 to 23, 45 to 50, and 70 to 75 when we started. And the idea was we would have data from women aged 18 to 95 in 20 years, instead of the 77 years it would have taken if we started at 18 and gone on. So we actually do now have these data. I'm sorry, all my pictures have disappeared from here, but never mind. That seems to be saying that, oh no, that now, and there's a bit of a model up here with the circles, but now, 2026, the young group are now kind of menopausal, 48 to 53. The middle group are now 75 to 80. And the older group, most of them have died, but some have survived. We've got 3 who are 105. So the study continued, and I'll come back to it later on. When this advertisement appeared in the paper. Now, this was really appealing to me. I had been working at the time with Adrian Bowman on the Active Australia campaign in Sydney. And this was an advertisement for somebody with a background in human movement studies who wanted, they wanted a professor, the first professor of physical activity and public health. And I read the ad and thought, this is describing my background beautifully. I'm going to apply. And everybody said, you're crazy. You can't apply for a chair. You're a lecturer C at present, is kind of way above your grade. But I applied for it and they had faith, and I got the job in 2000 and started. So the roles were reversed. Now I'm going to go to Queensland. Now so much has happened since that time. Some of you know about some of the work I've done in the 25 years at the University of Queensland. And I'm only going to talk to you about 2 projects before I tell you something about what's happened with the long study. I call it the long study, the longitudinal study. So this is the first one. This was a demonstration project funded by the Queensland government, who wanted a team of researchers to develop a whole community intervention to increase physical activity. And we came up with this idea of 10,000 steps. There was huge debate. You'll never get people to do 10,000 steps. That's crazy. So we wrote the bid. It was called 7,000 steps, Rockhampton. But when we came to actually implement it and talking to the community, they said, no, you've got to call it 10,000 steps. So that's how it ended up. We worked every way we knew. So in Rockhampton, every night for 2 years, the weatherman on the local channel would say, and have you done your 10,000 steps today? The doctors were giving out pedometers, you know, the old ones on the belt, nothing, there was no Apple Watch then. Everything we knew, librarians asking people if they wanted a pedometer with their book, everything to throw at the community to get people to do 10,000 steps. It wasn't that successful, to be honest. The women changed. There was about an 8% increase in the proportion of women meeting physical activity guidelines. The men were not interested. They thought it was a complete waste of time to count steps. What is the point of walking? You need to do vigorous exercise. But these are just some of the signs we put up around Rockhampton. And at the end of the project, even though it wasn't hugely successful in terms of outcomes, the government liked it and provided funding for every other city to now implement 10,000 steps, which is an amazing story to have implementation before you've even shown that it works. But every town and city started to make 10,000 step walks. This is a coal mine, bottom right. Fly in, fly out workers, and they made a track which went around so that miners could count their 10,000 steps. And Kerry Mummery from Canada was the person living in Australia who drove a lot of this on the ground at the time. The project was replicated in Ghent by a young woman student then, Katrine de Cocker, who subsequently moved to Australia to work with Stuart for a while, is now back in Ghent. The second thing I want to talk to you about from that period when I was appointed to the position at UQ was that in 2012 we were invited by the Australian Government Department of Health to review current physical activity guidelines. It was myself, Adrian Bowman, Fiona Bull, another former Loughborough student and staff member, and Nicola Burton. And I came up with this graph, which I call my relative risk of anything graph. And it's a little bit similar to something I think that Adrian showed yesterday, where there's a steep decrease in risk of anything, in this case, when you move from doing no physical activity to some, but there's no obvious threshold or optimal amount. And we decided that this area here between 2.5 and 5 hours, or 150 to 300 minutes per week, seemed to be an area that people should be aiming for to get the best results in terms of relative risk of anything, and not much gain further than that. We wrote the guidelines. There were 5, some relating to strength training and sitting time, but this is the one about physical activity, and we said accumulate between 150 and 300 minutes a week, or 75 to 150 minutes vigorous, or an equivalent each week. We wrote the report in 2012. The government did not like it. They said you cannot give a range, you need to have a target. Everybody else in the world says 150 minutes. How can we possibly suggest 300? People won't do it. They won't like it. This is nonsense. You can't do it. I said, well, we reviewed the evidence. We think this is what it says. So finally, very quietly in 2014, 2 years later, the government released our guidelines, which is this. And nothing more was said. Until 2018 and 2020, when the US and the World Health Organization came out with their guidelines. Now, I'm not sure if they put them through any plagiarism software, but I'm quite sure if they did, you would see the exact same words as we had written in 2012. So I guess that was when Australia first started to say, okay, it's okay, we can have 150 to 300 minutes. In the meantime, I had been focusing a little bit on exercise during pregnancy. I'm not going to dwell on this, but I was in Lausanne last week developing guidelines for athletes and pregnancy. But just getting back quickly for the last 5 minutes to the Women's Health Study. Thousands of people have worked on this study since 1996 when we started. Claire Madigan's here today. Nice to see you again. And she and Amanda worked with us. Claire came out as a student in 2015, and they looked at weight and weight cycling in the study. But probably one of the most important papers was this one led by Toby Pavey, published in 2012, looking at the relationship between mortality and sitting hours. And it was one of the first to show that sitting for 8 or 9 hours a day is really not good for your health. This is in our older women who were in their 70s and 80s at the time. And we saw all of this change between 2007 ACSM. There was all the story about lipoprotein lipase and what's happening to your poor old muscles. Now you're all sitting there quietly and not using. You better start moving your feet about a bit because sitting is killing you. And we heard this over and over again. But we carried on to look at the data and showed that in our older cohort, 76 to 81 years old, for those who were meeting physical activity guidelines, there was no relationship between sitting time and mortality. It was only in the ones not meeting guidelines. And these data were a stimulus for Ulf Ekelund and others at NIH in Norway to bring together all the data from 15 longitudinal studies which had included sitting time and physical activity, harmonize the data into a meta-analysis, and look at the relationships between sitting time and physical activity. And the title, does physical activity attenuate or even eliminate the detrimental effects? And the answer is yes, it does both. It was published in The Lancet. It's a very highly cited paper. In the altmetric score, it was number 16 in the world in 2016 of all papers published in any discipline, which was pretty remarkable in terms of attention score. And I still obviously refer to that paper a lot. So is sitting killing you? No, sitting is not killing you if you balance sitting with activity. So getting back now very quickly to the longitudinal study, I'll just skip that one out for a minute. We've been looking at trajectories of physical activity in the mid-age group, the mid-age cohort, and we find that they fall over 21 years into 5 groups. The ones who are not meeting guidelines, the ones who are meeting guidelines, that's the shaded colour here. 2 groups that are changing physical activity over 21 years, some increasing, some decreasing, and a group up here who are doing twice the upper level of the guidelines. Now remember, these are women in their 60s and 70s, and they're doing 2,000, 2,500 net minutes per week. And when we, skip that one, when we look at medication costs associated with these 5 groups, we see that when they were 50 years old, the ones in the high stable group had slightly lower, these are costs of medication, so out-of-pocket costs to the women, were quite low. They were higher in the low stable group. And costs increased over time because of inflation and because of aging, and they were getting sicker for various reasons. But the rate of increase is obviously much higher in those in low physical activity. So that by the time they were 70, the difference was about $1,000 per woman. And considering there's 3,000 women, 3 million women in this age group, that's a lot of money potentially to be saved if we could move women from this line to some of these other lines. And I would commend those of you that are starting to do this epidemiology and clinical exercise physiology here in Loughborough to always try and get a handle on Medicare costs or health service costs, because these are the data that interest governments more than anything else probably. Time, very quickly. Fourth cohort of women, same age as the young cohort, born 13 years later. We saw at age 21, the first cohort weighed 62.7 kilos, after 4 years, 65 kilos. The same age women, 13 years later, weighed 4 kilos more on average, and the rate of increase was higher. In 2000, we predicted that the first cohort, if they continued on this trajectory, would weigh 76.5 kilos. So young women in the audience, if you're 60 kilos now, you're going to be 76 kilos when you're 40. It's pretty horrifying, right? But we have the data, and that's exactly what has happened. And those are the data points. That's not fiction. These are real data, fell exactly on that line. So the trajectory of average weight established here has continued. And if we apply that to the new cohort, they're going to weigh 93 kilos by the time they're 40, which is pretty horrific because, as you know, weight and weight gain are associated with every single health problem except for things to do with bone density. It's actually protective. So these are data on diabetes from our cohort showing exponential increase in diabetes with BMI. So I have to finish. They're going to come and push me off the stage. Physical inactivity, in my view, written in 2018, is the Cinderella of risk factors still, and it should be more centre stage. This is a cartoon from the Newcastle Herald cartoonist showing the picture of his house on the day that I published my first paper on physical activity and health and women, showing that women's physical activity and women's health problems are caused by a lack of exercise. So from exercise physiology to physical activity and public health, I have no idea. I had no map, no plans. I never wanted to do a PhD. I had no postdoc training. I just took a series of opportunities. And to all the young people in the audience, I would reiterate Martin's comments from yesterday. Help everybody, collaborate with everybody. This is my collaboration map. And take every opportunity you can to learn from people in other disciplines. And that way, you'll make worldwide friends, and you'll always be able to come back to African Violet at Loughborough. My love for physical activity and health was established here. Thank you.